Welcome to NCSS Here for You. Since 1958, Northwestern Counseling and Support Services has been providing access to high-quality services which promote healthy living and emotional well-being to the residents of Franklin and Grand Isle counties. Over the years, as the needs of the community have changed, so too have the programs and services that we make available to assist children, adolescents, adults, families, and seniors. We take our role in the community seriously and strive to provide the highest quality services. According to Eric Erickson, a noted developmental psychologist, every person must pass through a series of 8 interrelated stages over the entire life cycle. NCSS provides a continuum of services to meet the needs of individuals who at any point seek assistance. NCSS's purpose is creating a stronger community, one person at a time. Now, let's get to today's show.
I'm Joe Halko, Director of Community Relations for Northwestern Counseling and Support Services, and welcome to another episode of NCSS Here for You. Each month on this program, we discuss a human services topic, and we do that with staff from one of our 3 service divisions. Our 3 service divisions are Behavioral Health Services, Children, Youth, and Family Services, and Developmental Services. And, on occasion, we have guests from organizations that NCSS collaborates with throughout the year. At this point, I'd like to take a moment to mention that this month's episode is dedicated to the memory of Stan Beauregard, who passed away late last week. Stan, along with Larry Dugan, were the visionaries that brought local access television to our region. Without Stan's determination and dedication, we wouldn't be on the air today. Now, this month's episode is titled Trauma-Informed Care. A national model is being implemented at NCSS that includes all 3 service divisions, Behavioral Health, Children's, and Developmental Services, plus administration, as well as clients that receive services to increase the capacity of the organization to provide trauma-informed care. Over 120 organizations nationally have participated in this program, which leads to safer environments, addressing staff self-care, providing trauma-sensitive services, and avoiding re-traumatization of those that we serve. To discuss the Trauma-Informed Care Initiative in greater detail, I'm pleased to introduce this month's guests, and they are Julie Parker, Outpatient Crisis and Integrated Health Services Program Manager in the Behavioral Health Services Division, Samantha Thomas, who's Children's Initial Response Team Leader in the Children, Youth, and Family Services Division, and Scott LaValle, Team Leader of the Behavioral Support Team in the Developmental Services Division. I want to welcome all of you to the show this month.
Thank you, Joe.
Now, to begin with, let's start with what is trauma?
Sure. So I could start there. Trauma is described as something that's painful or emotionally distressing that happens to someone. It could happen, there could be one traumatic event, there could be multiple traumatic events in someone's life. Typically, it makes someone feel powerless. The situation might be brought upon them. Might be something like a car accident. It could be something such as childhood neglect. It could be war. It could be terrorism. There's a whole gamut of traumatic events. It could be something like bullying, which sometimes people don't view as trauma, but in fact it is trauma. And certainly what might be something traumatic to you might not be traumatic to me, and we'll talk about that as we go on today. Trauma really overwhelms someone's ability to cope. And the event is very difficult, and it impacts someone's daily living. It could impact their work. It could impact their relationships with others. So it's a very distressing event that could involve loss, but in general, it's something that's very distressing and emotionally overwhelming for someone.
Mm-hmm. And when was NCSS selected by the National Council for Behavioral Health to participate in this trauma-informed care model, which again will increase the organization's capacity to address effects of trauma?
Sure. So in 2013-14, the National Council of Behavioral Health put out a application for agencies across the United States to fill out, and see who would want to be part of this collaborative, and we filled the application out and sent in some information about our agency, and we were chosen in 2014 to be a part of this model. We are one out of 60 organizations across the United States that was chosen, and as you mentioned, the team that we have made up at Northwestern Counseling Services is made up of various people across the service divisions, and also I think something that's unique is we've also made sure administration is part of our model, and we have folks from reception that are part of our committee as well, which we feel is really important.
And as an aside, are we the only organization in Vermont that has been chosen for this?
Yes, we are. Yeah.
Okay.
The closest one, I believe, is an agency in New York that was chosen as well.
Okay. And what is NCSS's trauma-informed care vision statement?
Sure. One of the things that we had to do is come up with a vision statement for our organization. And so it starts off with providing a calm and secure environment for both of our staff and our clients. We want everyone to feel like they have a voice in their own recovery. That's one of our imperative things. We want our staff to understand and respect that there is a whole range of traumatic events, and again, how people cope and how people interpret what is traumatic to them. And so we want staff to understand that. We want to deliver services that show that we are a trusting organization, we're a trusting staff, that we're respectful, we believe in people healing, and we are hopeful for people healing after a traumatic event. So that's our vision statement.
Okay. And let's talk a little bit about what some of the statistics are that are relative to the number of people that actually are affected by trauma.
Sure. It's pretty staggering, actually. So the National Health Council did various surveys and studies about trauma in different groups of folks. So one study, for example, clients that were served at public mental health centers, 90% of those folks indicated that they had had some type of trauma. So that means for every 1,000 people we serve, it's 900 people that would indicate that they have trauma. So we think that's a pretty staggering number. 80% of people in psychiatric hospitals would say that they had some type of trauma in their life. And again, I think that's another staggering number. That's a very high number. 66% of people that are in substance abuse treatment would identify having some trauma in their life, specifically childhood neglect. And 64% of people who, in this study, who attempted suicide also identified as having significant traumatic events and childhood neglect. And typically, when we talk about traumatic events, we talk about it, we think it's outside of the norm that a traumatic event happens. And I think what we've come to know in this work that we're doing is that traumatic events in folks' lives, at least one, is becoming the norm, and not to mention more than one. So it's pretty significant and pretty staggering, the number and percentage of trauma in the folks that we serve, and nationally of folks that are dealing with a traumatic event.
And I think with something you said there, Julie, which is, first of all, how high the percentages are, but what trauma is to one person is not to another,
Yes.
which I would say falls very much in line with, from a clinical standpoint, every individual that you serve is on a different plan because everybody's circumstances are different.
That's right.
So this falls in line with that.
Yep.
As to, has somebody experienced a traumatic event or numerous ones, or...
Yes, absolutely.
And is that something that perhaps, do you think it gets, I don't want to say overlooked, but I guess I don't know another word to use than that trauma from someone's life, possibly in the past, could have been overlooked if the right set of questions aren't being asked or discussed.
Absolutely, and it's something that we talk a lot about, and one of part of this collaborative that we're in is assessment. When a client comes in and we do an assessment on a client, are we asking enough questions to identify trauma? Are we asking enough things to help us understand what got them to this point? And one of the key things that we talk about is not to say to a client, what's wrong with you, but instead we ask, what happened to you? And I think that's really important in the way we phrase things, and also to help us identify what's happened that's brought you here, that's given you some struggles. And just like you mentioned, and I said earlier, I think someone could have a break of a relationship, and I could be fine with that, and my coping could be fine, and I could use my friends for support and continue on. And with someone else, that could be very devastating, and it could impact their coping and make them feel unable to cope.
Sure.
Yeah.
Sure.
So, yeah.
Now, what is the impact of trauma over someone's lifespan? Another way to look at this.
Sure, absolutely. Well, this kind of lines up with what Julie was just talking about, is that when we're talking about people experiencing trauma, we can be talking about somebody who has experienced one traumatic event over the course of their life or experienced multiple traumatic events. And so you could imagine that having one incident or multiple incidents could really impact how that is impacting the person's basically kind of daily life functioning, and that's from little ones, little kids, right up to the elderly. And it really is about what's appropriate for that person to be engaging with at their developmental level. And so trauma can really impact and disrupt some of that growth and development. And so you can see folks having difficulties in interpersonal relationships because sometimes if somebody has been harmed, they have a difficult time trusting other people, and so that can really impact how they engage with the world, whether it's close relationships or folks in kind of their broader circles. And there's actually been some pretty astounding research that has shown us that there are some physical impacts of trauma. So you might typically think that somebody who's experienced some traumatic events might experience some anxiety, some fear, some worry, maybe some sadness, maybe some depression, and all on different kind of levels and scales there. But there's some research that was done in the late 90s, and it's called the Adverse Childhood Experiences. And it's some really important research that shows us that actually, based on the number of adverse childhood experiences, so traumatic events that happen in youth, there are some really severe physical side effects and impacts that can happen as an individual grows older. Obesity, heart disease, diabetes, things like that, really significant impact. And so I think that's important to recognize too, is that really can have such an impact on the way we think about the world and how we relate, but also our physical beings over the course of our lives.
It's to do with the choices we make too. Substance abuse, there's a lot of things that impact the decisions we make as a result of trauma.
Absolutely.
And as you're saying that, something that comes across my mind is another initiative that we're very much involved in as an organization, which is the integrated healthcare model. And just with what you said there, Samantha, when you think about it, somebody goes to the doctor and maybe they are struggling with obesity, or maybe they become a diabetic or what have you. And one area that perhaps would never get touched from a primary care scenario is the fact of how did we get here? It's just we're now treating whatever symptoms you're displaying. And when we talk about serving the whole person and how your physical and your mental states together, once you have a real good sense of that, you can really begin to assist and help the individual's whole being. And it's kind of interesting what you had to say about, especially in young people who have had some traumatic incidences, that, as I said, as you go through life, and as Scott said, maybe they become an abuser of substances, and the real reason for that was borne out years earlier in some event that they were exposed to, or, and it's trying to deal with all of that. As opposed to, what I'm saying.
Absolutely. Well, and Julie had mentioned that it's really about events that overwhelm someone's ability to cope. And so if someone is really struggling with how to cope, they might turn to some less adaptive coping strategies that will then impact them, as Scott was saying, over the course of their lives.
Yeah.
And just as we had said, we may not be asking the right questions. Someone might not identify that they had a trauma in their life, and so that's another reason why it's important to ask. So we might see some symptoms, we might see some troubles with substances, and they might not ever tell us about their past until we say, did something happen that led to some unhealthy coping mechanisms. So that's why it's really important to talk about.
Now, what are some of the protective factors for someone who's encountered multiple experiences with trauma?
Sure. So there's I think when we talk about trauma, we oftentimes are talking about all the negative impacts, and it's so important to talk about. So I'm glad that you asked, what are the protective factors? Because, when we have either individuals in our lives, maybe support systems, whether that's family, friends, coworkers, church participants, whatever that looks like, folks that are in our lives, that's a real protective factor for someone who's experienced a traumatic event. Because one thing that we know about is that it's important when we've experienced trauma to really talk about how we're feeling. It's maybe not necessarily that important to say this is what happened to me and yada yada yada, but it's important to be able to share your internal experience. So when you have some support of others, that's really important. And I think we'll talk a little bit later about reaching out for support. And so sometimes if you don't feel like you have that close person that you feel like you can communicate with, reaching out and building that relationship, whether it's with a professional or not, those are really important pieces and can really protect against developing those more significant outcomes and impacts.
Now, let's talk about situations where a person becomes overwhelmed by trauma and experiences serious mental health consequences due to that. What are some of the indications that people can look for?
So like I was talking about before, the impact, it really can impact somebody's ability to function just in the course of their daily lives. So, if you are starting to notice someone around you who is having a different kind of pattern of behavior. Maybe they are more vigilant to what's going on around them. Maybe they startle easily. Maybe you're noticing that they are much more anxious or worried than is typical, or you're seeing their mood shift. They're more depressed or maybe not showing much emotion at all. That can happen for some folks who experience trauma. It almost feels like they aren't experiencing any emotion. So those are some pieces to kind of look for, and you can see that either as a real pattern of behavior or somebody can experience that very acutely in a moment, and that can be quite visible. Both of those pieces are concerning, and to just be alert to that and reach out if possible and appropriate.
So it's really for individuals that are somewhat close to those people who begin to see that these other patterns are emerging, and it's the first time they've ever seen these sorts of behaviors, that you can kind of be on the lookout for perhaps there's something else underneath the surface that they're dealing with.
Yeah, I think that's fair, because I think one of the things that we've learned, that we've been talking about trauma lately in our field, and it's been so helpful because what we have learned is that when people have experienced particularly really chronic trauma, they will develop a number of symptoms that can look like maybe other mental health diagnoses. And so it's really important to be able to be alert to those pieces, but also recognize, like Julie said, kind of what happened to you. And I think, you were talking about a person close to you, as far as being able to feel comfortable asking somebody. I do think that that's important, because somebody who's experienced maybe a violation of their personal space, or, that can feel kind of threatening. But maybe helping to find somebody who is closer to that person that could reach out to make that connection, or even just offering, a card or a resource, so that, you're not necessarily saying, hey, I think something might have happened to you and I'm worried about you, but hey, if you ever need support, I've heard of this agency or this phone number, somebody could be helpful.
Now, why is trauma-informed care important at NCSS?
There's quite a few reasons why it's important to NCSS. In short, it's to provide better services, more effective services, but there's a lot of pieces that kind of fall into that to help us. One of the things was for us to better understand the life situations that people have experienced or are experiencing, and how they might affect current problems that we're trying to help them with. That's kind of a way of looking at it that might be different than if we didn't use trauma-informed care. You'd be trying to treat the problem as you see it, without realizing that there could be trauma in the past, whether it's multiple traumas or one significant event. And then it comes down to looking at our environment. Are we providing people with a safe place where they feel comfortable coming to, they feel respected, they feel people are compassionate? And then recognizing the trauma they experienced it looks different. You know, we've been talking about that. It looks different to other people, and you might not see the environment as traumatic, but someone coming in the doors may. It could be smells, music playing, you know, institutional kind of setting. It could be anything that might re-traumatize the individual coming through. So we really have to take a look at the environment, people, how we interact with people, and respecting their choices. So there's a lot of pieces that come into it, why it's important, but the bottom line is it's important because it helps us provide better services.
Now, what progress has been made to date since the Trauma-Informed Care Initiative began at NCSS?
Right, so we started, it was about a year ago, year and a half ago now. So that would be after the whole process of the application. The first thing that happened was a core implementation team was put together that had members from each of the service divisions as well as administrative. And then we had webinars to kind of educate ourselves along with the other 60 organizations that comprise the community that we're in, the learning community. You know, so that's kind of where it started. You know, it took a few meetings to kind of get our traction, to figure out what direction we want to take, to educate ourselves as to, you know, what does it mean? Because trauma, you're making it more than just a catchphrase. You know, what is trauma? Not just, you know, everyone I think would associate it with post-traumatic stress disorder, and that's kind of where it would stop. But recognizing that something significant could have happened to someone that might not seem significant to me. So a lot of the beginning part was just kind of getting our traction and figuring out kind of how to move forward with it. You know, then we did an organizational self-assessment. I'd say that probably was about 10-15% of the overall staff at NCSS filled this out, and it was pretty extensive. It identified how staff felt we were doing in key areas, and then we put that all together to kind of have a baseline data of, you know, here's where we are at, and then we actually just re-administered it a year out to see where we're doing now after we've done some, we called them trauma 101s. We had presentations to try and educate the workforce, community partners, as to, you know, kind of what we're trying to do. We had to decide on 4 cohorts of what we were going to address, and we've talked about them a little bit: screening and assessment, improving our ability to recognize trauma for what it feels like to that person, not with our own identification of trauma. Workforce development, that was the education, the webinars, the trauma 101s. You know, we did presentations to down at SOAR. We did them for the administrative group and the facilities people. Safe environment, we did an environmental components assessment, and that was reasonably extensive too. We actually had people that received services do the assessment, so we got an idea of how they felt when they came in the doors, if they felt safe. Some of the questions on there were, you know, involving the paint colors, the carpeting on the floor, lights in the parking lot, you know, just so we could get an idea of how they felt when they came in. And then, you know, we put all that together, and again, so we're trying to work on that actually currently to figure out which direction, what things we want to address, how people perceive the agency when they walk in the doors, as far as if they're comfortable, if they feel safe, respected. So those are a lot of the things. We're also working on best practices and treatment models to make sure we use evidence-based treatments when we're trying to help people, that we're not just kind of, you know, just doing things to do them. We're actually, there's evidence that suggests this might help with this, and so we try to employ those methods. Those are the 4 we decided on. So it's been a lot. There's been a lot of thought, and we've met once a week for the first year. So we've developed little committees to address specific problems where maybe the group that we had wasn't the best group to figure out how to deal with this. So we had little committees to try and figure out the best ways of dealing with things.
And one of the things you're mentioning, Scott, just about the environment, if folks out there haven't been to our building recently, you will see that we've made some significant changes in the waiting room. We've actually changed our paint colors. It used to be a very basic color, which I think, met the need of just kind of having paint on the walls, but it didn't always make people feel, that it was warm and inviting. So we've changed the paint colors. We have some different furniture that accommodate people of all different types and sizes. So just there's some specific things that we've gotten feedback from clients that we're making changes on. So it's been really nice to be able to do that.
Yeah, and through that we identified a lot of things that we were already doing well. There's a lot of things that we were really doing well. One of the things that came up in it was, the questions was pretty specific. The walls damaged, and I think the people who work in facilities, they've always done a wonderful job of making sure the place looks nice. When people come in, it's stuff's not broken. There wouldn't be a broken chair sitting in the waiting room or a hole in the wall, and it wouldn't be left like that. And I think that's important to people, because when you put yourself in their shoes walking in the door, and you see a big stain on the carpet or things like that, it kind of, whatever you're going through, it doesn't help it. That's for sure.
Yeah. Now, with all this being said, where can someone get help?
Well, folks can definitely, call Northwestern Counseling Services for support. There's lots of private practitioners in the community. You can turn to your church. You can turn to your family members. So if you need some peer support, turn to the people in your life you value and appreciate. And if you're looking for some more professional help, NCSS is definitely one stop. And you could call our general number, 524-6554, and explain what kind of services you're looking for, and we'll make sure we connect you with what you're looking for and what makes sense.
Okay, and what was that number again, Julie?
It's 524-6554.
It's not a test. I just wanted to be sure if somebody ran to get a pencil that they
We have crisis services available 24/7, and it's the same number, and just listen carefully for the prompts that walk you through after hours how to access emergency services.
Okay. Well, believe it or not, our time is up this month, and I want to thank my guests, Julie Parker, Samantha Thomas, and Scott LaValle, for being on the show today and sharing their insights on how NCSS is taking a leadership position by evolving into a trauma-informed care organization. I also want to thank you, the viewer, for spending time with us again this month. You can learn more about NCSS and all of our programs and services by logging on to ncssinc.org. I'm Joe Halko, and I'll be back next month with another episode of NCSS Here for You.
This has been another episode of NCSS Here for You. We hope that you found today's discussion informative and educational. Since 1958, Northwestern Counseling and Support Services has been providing access to high-quality services which promote healthy living and emotional well-being to the residents of Franklin and Grand Isle counties. Over the years, as the needs of the community have changed, so too have the programs and services that we make available to assist children, adolescents, adults, families, and seniors. Thanks once again for tuning in this month. NCSS's purpose remains creating a stronger community, one person at a time.